Before starting Eculizumab, make sure to read the medication guide provided by your pharmacist. This medication is given by injection into a vein by a healthcare professional as directed by your doctor. The usual dosage is once every 7 days for 5 weeks, then once every 14 days. The dosage is based on your medical condition, and for children, it is also based on their weight. While receiving this medication, you may experience infusion reactions. If you have symptoms such as throat swelling, shortness of breath, chest pain/tightness, dizziness, or feeling faint, tell your doctor right away. It's important not to stop receiving this medication without consulting your doctor, as your condition may become worse. If you do stop, you may need to be monitored for at least 8 or 12 weeks to make sure your condition does not worsen. If your condition does not improve or worsens, make sure to tell your doctor. If you are taking Eculizumab solution, you may experience headaches, tiredness, diarrhea, nausea/vomiting, or muscle pain. If any of these effects persist or worsen, notify your doctor or pharmacist promptly. It's important to remember that this medication has been prescribed to you because your doctor has determined that the benefits outweigh the risks of side effects. Many people who use this medication do not experience serious side effects. However, you should contact your doctor immediately if you experience any serious side effects, such as signs of infection, muscle cramps, swelling in the hands/ankles/feet, fast heartbeat, or signs of kidney problems. While very rare, a serious allergic reaction to this drug is possible. Seek medical help right away if you notice symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA. If you are in Canada, you can report them to Health Canada. Before using Eculizumab solution, it's important to talk to your doctor or pharmacist about any allergies you may have. This medication may contain inactive ingredients that could cause allergic reactions. It's also important to discuss your medical history, especially if you have had recent infections or vaccinations. Before undergoing any surgery, make sure to inform your doctor about all the medications and products you are using. Eculizumab solution may increase your risk of certain infections, so it's essential to talk to your doctor about the potential risks. You may also need to be vaccinated against certain infections before starting this medication. It's important to let your healthcare professional know that you are using Eculizumab solution before getting any immunizations or vaccinations, and to avoid contact with people who have recently received live vaccines. If you are pregnant, Eculizumab solution should only be used when clearly needed, and it's crucial to discuss the risks and benefits with your doctor. It is uncertain whether this drug passes into breast milk, so make sure to consult your doctor before breastfeeding while using Eculizumab solution. When taking Eculizumab solution, it's important to be aware of potential drug interactions that could affect how the medication works and increase your risk for serious side effects. Be sure to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share this list with your doctor and pharmacist. It's crucial to not start, stop, or change the dosage of any medicines without your doctor's approval. This will help ensure the safe and effective use of Eculizumab solution. If someone has taken too much of Eculizumab solution and is experiencing severe symptoms like fainting or difficulty breathing, it is important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center. It is crucial to act quickly in the event of an overdose. During your treatment with Eculizumab solution, it's important to undergo regular lab and medical tests, including LDH levels, kidney function, complete blood count, and blood pressure checks. These tests should continue for 8 to 12 weeks after you stop using the medication. Make sure to keep all your medical and lab appointments. You will also receive a patient safety card that lists symptoms you need to be aware of. Carry this card with you at all times while you are using the medication and for 3 months after you stop. If you experience any of the symptoms listed on the card, seek medical help immediately. Be sure to take each dose of Eculizumab solution as directed by your doctor. If you happen to miss a dose, it's important to consult with your doctor or pharmacist to establish a new dosing schedule. This medication, Eculizumab solution, is administered in a clinic setting and should not be kept at home. It is used to treat a specific blood disorder called paroxysmal nocturnal hemoglobinuria, PNH, and atypical hemolytic uremic syndrome, HUS. The dosage and frequency of administration will be determined by a healthcare professional based on the individual's condition. It is important to follow their instructions carefully. This medication should be taken at the same time each day to maintain a consistent level in the body. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.